Okay, so thank you all for coming today. For the benefit of the video recording, I am welcome to Community Action's Project Fusion presentation and workshop. We are just going to be recording the presentation parts. This is so that during the workshop we can have a free and open conversation. All the remarks and all the points will be written down, and they will be available after the recording and once the process has gone through. So we've just done a little bit of housekeeping. I'm Sandy Belfitt from the Community Action Isle of Wight. Schedule for tonight is we will listen to Fran Wight, who's going to tell us about integrated care systems, integrated care boards and integrated care partnerships. Then I will talk a little bit about my role in community action, and also talk about the proposed voluntary sector and integrated care partnership collaboration that's going to be called HIVCA. Claire will talk to us about Project Fusion and the Isle of Wight. So thank you, Claire. I know you're standing in for Leslie Stevens tonight, so thank you for standing in at short notice. And Anastasia will then give us some background to Project Fusion, which is all about the mental health review and the recommendation for a single trust. At that point, we will stop recording, and then we will all have a discussion about the project and airing points that we'd like to make, things that we would like to see once the service is set up, and then we will have a roundup and close down, and hopefully we will finish by 9 o'clock. I sincerely hope so. So so if I stop sharing, it's Fran's up first, and to tell us about ICBs and ICPs and ICSs.
Thanks, Sandy. And let's see how it says host disabled participant screen sharing. I can't hear you. Oh, here we go. Brilliant. Thanks. Here we go. Let's do this. And I will, as I say, I'm not used to. Can people see that?
No, not at the moment.
Not at the moment. Oh, here we go. Let's do that now. Now, hopefully you can. Yeah, brilliant. Thank you. I'm more used to Teams, so I'm just getting my head around this. So hi there, I'm Fran Wight. I'm the Senior Strategic Partnership Lead for the Hampshire and Isle of Wight Integrated Care System. So my role is primarily, it's actually quite similar to how Sandy described hers the other day, is that my role is very external facing for the Integrated Care Board, and I focus on all our external relationships across the Hampshire and Isle of Wight system, so voluntary community sector, but also police, fire, local authorities, the whole group. So this is now where I learn how to change the. Here we go. Great. So so I was asked to give a bit of an update on what is an integrated care system, what does it mean, how does it change, what does it mean, and I'll touch a little bit on how the voluntary community sector plays into that. So this is a bit of a sort of NHS history in terms of where how have we got to integrated care system. So all the way back in 2012, over 10 years ago, we had strategic health authorities and primary care trusts, and they were systems that were really built to encourage competition across our NHS providers. We paid a lot by activity, and it's kind of explains why we are where we are at the moment in the health system. Most people will remember the clinical commissioning groups, which were in place in our system from 2013 up until July this year. So clinical commissioning groups, and the idea was that they were smaller, clinically led organisations that were built around a small population. So it was normally about 200,000 people, a population of a clinical commissioning group, and obviously the island had their own CCG there. It was very much around localizing, but the competition element still often remained in clinical commissioning groups. So there was still quite a lot of competition between our NHS providers, and there was still quite a heavy contracting process around those. And then about 5 years ago, something called Sustainability and Transformation Partnerships established, and that's recognised that there was some benefit to working at a wider geography across a Hampshire and Isle of Wight system, but they never really had the authority or power to influence change. So the commissioning structure still very much led what we did. In July 2022, this year, the easiest way to describe it is that the Sustainability and Transformation Partnerships became integrated care boards. So Hampshire and Isle of Wight system, the clinical commissioning groups stopped on the 30th of June, and on the 1st of July, we all came together as an integrated care board across the Hampshire and Isle of Wight geography. Now, that doesn't mean that we're not still focusing on local services. That doesn't mean that everything's going to go pan Hampshire and Isle of Wight, because we still recognise that working with local communities is absolutely critical to the care that we deliver. But there are some things that we can more usefully do at scale together, things around things like sharing data we can do once across the system, those sorts of things. So that was the idea behind it. So the integrated care system is the idea is it's a partnership of organisations come together to plan and deliver joined up health and care services and to improve the lives of people that live and work in their area. And there are two parts to the integrated care system. There's an integrated care board, which functions very much like the clinical commissioning group did. The board is more inclusive, so we have social care on our boards now, and we also have our NHS providers that sit on the board, but their role is around delivering and ensuring the delivery and planning of the NHS constitutional elements of our healthcare system. So it is around planning, resource allocation, quality, transformation, and will function very similarly to a clinical commissioning group, but with a few nuanced differences. And then we have the partnership, which I think is the exciting bit, because that's my role, which includes far more partners. So it's a statutory requirement. We have to have a partnership. It has to be co-owned by the local authority and the ICB, the Integrated Care Board, but actually it will include, and definitely in our local area, it will include an awful lot more partners around the system, including the voluntary community sector, which I won't ruin Sandy's section on that, but we'll have police and we'll have the fire service on there, we'll have research institutes on there, we'll have Healthwatch in the room, and I will have missed someone, but we'll have a whole partnership of people coming together. And the role of that partnership is to set the strategic direction for the whole of Hampshire and Isle of Wight. So to say, where do we work together in Hampshire and Isle of Wight, and how can we work together? And then it's for the individual organisations in that partnership to drive that change forward and to hopefully work together to do it as well. So to give a bit of context of our system, we have 4 places in our system. So we have the Isle of Wight, which is a nice island, so it's very clear. And then we've worked on the local authority footprints for the other 3 areas. So we have a Hampshire system, Hampshire Place, a Portsmouth Place, and a Southampton Place alongside Isle of Wight. So there's a health and wellbeing board in each of those places, and then there's also a health and care partnership underneath that that will drive the delivery. So similarly, really, to the integrated care partnership and board, you'll have that at a local level as well. And that slide there is really just giving you some context into who are we, how big we are, how we're made up. So we're quite a big system. We're one of the biggest ones, I think, in the country, 1.9 million across, and one of the challenges across quite a large geography, quite different populations. So why will an integrated care system be different? We know that working together is better for our population. We know it drives better health outcomes, and we know that people are healthier if we work with our partners. So And we've known that for a long time. And sometimes it's just that the structures haven't been there to enable that. So the idea of the integrated care system is that by bringing our structures together, we're enabling the things that we know make a difference to our population. And so there's 4 core aims of an integrated care system. One is around improving the outcomes in population health and healthcare. One is around tackling those inequalities in outcomes, experience and access. We still have to make sure that we use our taxpayers' money effectively, and we still need to enhance our productivity and value for money. That hasn't gone. But there's a new aim, which I think is quite interesting, which is around the healthcare's role in supporting the social and economic development of our system. So there's lots of evidence that if you've got a thriving community and people are contributing to that community, whether that's via work or via volunteering or via being an active member, that their health outcomes and their sort of broader well-being outcomes are much better. And they've built that in to sort of some of the NHS aims. And then this is a way of trying to explain all the different components within an integrated care system and how they all fit together. And we may not have cracked it. This is the 3rd time now we've shared this slide, but hopefully we've not had to. It seems to make more sense than any of the other ones that we shared. So let's see if it makes sense. So right at the top, we still have those organisations that we know. So Department of Health and Social Care, NHS England, and the Care Quality Commission, they are still there. They still do the roles that they do. There's a few mergers going on at the top, but fundamentally there's those 3 organisations are still there, and they still assure the work that we do. And then locally in our integrated care system, we've got partnership, which is what I described with all our partners. And then we've got the integrated care board, which is, as I've described, is sort of doing some of those more traditional clinical commissioning functions. And then underneath that, there are an awful lot of other ways that people are coming together. So at a Hampshire and Isle of Wight level, our acute providers and also our community and mental health providers come together to set the direction for their parts of the system. We have transformation programs that are still running. So people will have heard of the digital program that's running, and there'll be programs around elective recovery and elective services in the hospital. Those programs are still there. And then there are clinical networks. So there's a cancer network and a diabetes network, and they are still there and still doing the work that they've done for a very long time. And then, as I've described, there's 4 places, and each place has a health and wellbeing board, which is fundamentally sits with the local authority, but we work very closely with them on that. And then underneath that health and wellbeing board, there's a partnership, which is all around delivering those local objectives around the health and care partnership. I won't labour too much on the local delivery systems because they're not so specific for Isle of Wight, because your local delivery system is the same as it's the same footprint as your health and wellbeing board and your partnership. But for some of our other areas, we chunk the areas down a bit around the footprints that people travel to. So if you live just outside Portsmouth, you're likely to go to Portsmouth Hospital rather than to go to Hampshire hospitals, just because of naturally where you sit and where you live. And then probably the most important layer, we almost need to turn this slide upside down, I think, is around the neighbourhood level. So actually we know that all the work that everyone does and all the difference that is made is actually at the very local level. So that's thinking around primary care networks, but actually thinking around some of those community services that you provide on an ultra localized level, and which the VCSE sector are sort of the experts in, really. And so in terms of the integrated care partnership, which I think, as I've said, I think is the partnership working bit is the most exciting bit of the new ICS system. Although the integrated care partnership hasn't yet formed, it's due to form in April. So whilst the board was formed in July, we're still setting up that partnership element. We have started to build a strategy for the system. So we did work with lots of partners. We had community events in September. We've had one very recently in February. We've worked with our statutory partners and with the police and fire and things to say, so actually as a system, where are our key priorities? Where do we need to focus across the partnership? And what came from those discussions is 5 key priority areas. So children and young people, mental well-being, good health and proactive care, our people and our workforce. And I mentioned yesterday, our people and workforce does include our volunteers, does include our carers, both non-paid and sort of domiciliary carers, and does include that wider workforce in terms of who actually works in Hampshire and Isle of Wight and how do we support them. And then also, very, as mentioned before, digital and data. So how do we share our information better across the system? The good health and proactive care, it really focuses on those preventative elements. So really getting ahead of the curve. Our strategy is very focused on the wider determinants. It's very much thinking about how do we stop people getting sick in the first place, and then when they do get unwell or when they do have caring needs, how do we help them to manage those conditions so that they live the fullest, most independent life that they can. And underneath each of those 5 priorities, there's sort of a number of things that we've pulled out as key areas. And the bit that we're doing now is saying, okay, so what under those key things can we usefully do together in partnership? And I think that's where I paused yesterday. And I think that's where I'll pause today as well. And I'll stop sharing so I can see people's faces.
Lovely, Fran. Thank you. Has anybody got any questions for Fran on that? And so you can use the chat if you prefer to do that. Fran, could I ask you to put me back as a host, please?
Oh, yeah. Yeah. How do I do that?
I thought Annette had her hand up.
Annette, yeah.
Claire knows what I'm going to say. We have heard some of this before. Many times.
You're going to mention the, what was it called? A full life, a better life or something?
My life, a full life.
Right, yeah.
Yeah.
And numerous other rethinks. It's just the ST, whatever it was, obviously didn't have any teeth. So it is a struggle for everyone to understand the difference between a board and a partnership. But will the partnership have teeth to change things?
Yeah, it is statutory. And
what does that mean? Does that just mean the big trusts are going to shout out the smaller voluntary sector organisations? Because we have all talked about working with the voluntary sector before, and clinicians are just frankly so busy, they don't have time to even Google who their nearest group is.
So, I mean, I suppose the role. So we've heard that people have said this as well before. It's a little bit why I've sort of mentioned the Strategic Health Authority.
And same with the whole mental health agenda, I think, is getting better, but I can't emphasise how crucial that is for the people in the groups that I've been involved with, and that's been a struggle right through, and it just needs such high priority.
And I think the will is there. Whilst the partnership hasn't formed, it is in law. You have to have a partnership, and that partnership has to set a strategy. And then that strategy, those individuals that sit on the partnership also sit in the individual organisations that are responsible for delivering it. So whilst it doesn't have a accountability role in terms of holding the ICB to account or the local authorities to account, it is made up of the partner organisations who need to deliver the strategy. So theoretically, people should be going with individual accountability. Now, recognising where our system is I'm not going to say that we're suddenly going to stop worrying about A&E targets. Of course, there are pressures in the system that organisations are going to need to focus on. But the very purpose of the integrated care partnership is around role modelling partnership working for the system. So it will set the strategic direction, and it will need to demonstrate its delivery around those priorities. So I can't say whether it will work or not. You're not the first person to say this sounds like.
I don't know whether this was discussed more face to face, and I'm sure it is a national issue, but it's massive on the Isle of Wight. So unless the care system is fixed nationally, funded properly, and that political parties get off the fence and do what they've been promising to do for a very long time, the rest of it's going to fall apart. And I see you've got the local authority around the table, but and I think you've mentioned the domiciliary carers and so forth as well, but how much power have they actually got to change things, when actually to improve things there is going to make it will make a massive difference to my family and friends who are sick and need care. And they sometimes need to access the NHS. The NHS is so clogged up with obviously ambulances and A&E trolley weights that it doesn't function anymore.
Well, they are an equal partner, so they've got equal levels of authority on, it's co-owned. Yeah. Well, so that in law, they are jointly, the local authorities and health are jointly responsible for the partnership. That's in
the local authority funding isn't sufficient from central government. How is it going to fix some of these other things that we all aspire to? And you've beautifully outlined on your slide, but they're just not going to happen unless the care industry is properly around the table and funded. And as a carer.
And that's probably an answer that I can't sit and answer around, how do we draw more funding down? Some people have said actually by becoming as a partnership across Hampshire and Isle of Wight, you have a much bigger voice to influence up. So that could be a potential role of the partnership, is to have that by 4 local authorities coming together with our health partners, having one voice to influence up could be there. But I guess the proof will be in the pudding on that, in terms of, I don't have a direct line to Treasury, and nor does a partnership at the moment, so that funding element, there's only so much you can do within your gift, isn't there? And yeah.
Sharon, you've got your hand up.
Yeah, I'm just going to really back up what Annette's just said, to be honest. Obviously, from a housing perspective, one of the things that I've seen since coming over to the island is that my team are being relied heavily upon, especially where we've got tenants living on their own. They've got no connections to the island. That's not a housing role. We shouldn't be supporting them. We have to constantly email adult social care, and it takes a while. And I appreciate it takes a while, but it's about fixing it so it's not impacting others when it's not even technically their role. We're not qualified experts in it. We can only signpost. But yeah, I agree completely with Annette. It is broken, and it's going to take a while. And the concern overall is it's great to have that partnership. And I believe in collaboration. And when it works really well, it works brilliantly. I've been in places on the mainland where it's worked really well. But I've been here now on the island for 2 years. I'm not overly convinced, if I'm completely honest, that it will attempt to fix things.
I think that, I've been in this role for 4 months, and I think that this is new. This is new to the island. This is new to Hampshire and the Isle of Wight. This is new to everybody. There have already been a few ICSs in place for the last couple of years, and if you look, there's some really good stuff that's going on, and they work really well with other partners with the voluntary sector. I think for Hampshire and the Isle of Wight, particularly for the Isle of Wight, from what I've been seeing, is that the trust has to get away from seeing voluntary sector just as delivery partners, just as, well, we can't supply the service, we'll just dump it on somebody else at a cheaper rate as well. There has to be a cultural change. They ain't going to come overnight. We're not going to wake up tomorrow and they go, yeah, we understand. And that's kind of my job. And I'll go on a little bit in a minute, but my contract is for 3 years. I can't see it happening in 3 years. So it's going to be hard. It's going to be hard work for everybody. And absolutely, we need that. We need the funding. I don't know where that's going to come from. So I can see those who've been there, done that, tick the box, got the t-shirts. I can see, yeah, you're going, this ain't going to work. But I know we're at the beginning. Keep the faith. let's give it a chance.
I mean, I do. Like I say, the partnership hasn't established yet. It will establish properly in April, but the conversations are going on, and voluntary community sector are around the table on those conversations as well, and very, very active in them. And it does feel slightly different. I would say the will is definitely there from senior leaders across the system to make this work, because we've all got financial challenges, haven't we? So we all have to make it work, to do, you know, to improve the outcomes for our population. We are at the start. It will take a few years, and there's a lot of cultural work to do. But it feels like the will is there.
Right. Okay. So let's just pause on questions now. Let's crack on, and then we can get to the good questions at the end. So I'll just now bore you with what I do, and if I can remember to share the screen, and okay. It will move. Okay. Okay, so Sandy Belfitt, you know me because I emailed you all. So my role is the voluntary sector health partnerships officer for community action on the Isle of Wight. So if you are not aware of what community action is, we are called a community voluntary organisation, and we are the main support body for the voluntary and community sector on the island. There's several of us across the UK, all doing very similar role, and mostly supporting the smaller groups, the small support, peer support groups here on the island. Now, my job is, I kind of describe it as a sort of the filling in between the sandwich of the statutory care and health bodies, i.e. the NHS and the local authorities, and the voluntary sector. And so my role is kind of to put the two together and make sure that they're working together and collaborating. We use collaborating a lot. A better word, I think, is co-producing, because that is kind of the ultimate, is that we will be involved at strategic levels in co-producing services, not just delivering them. So my role is twofold. One is to poke, as my boss said, the NHS and the council to include the voluntary sector at strategic level. The other role is to make sure that the voluntary sector are able to become involved, because, you know, we as a voluntary sector are just as hard pressed as the statutory bodies themselves are. So that's my role. If you've got any questions, if you want to know a little bit more about your role, I'm very happy to come and have a chat. My role, rather, come and have a chat with you. And there's my email address there if you want to have a chat. So I pinched this from the Project Fusion workshop that I went to last week. Cormac Russell is a leading social explorer, and he's a member of the Asset Board Community Development Institute in Chicago. Asset-based community development is all about putting communities at the heart and empowering individuals, citizens, to have control over their own health. And it's if we work together and we learn from communities and empower them, then we can help them to remain healthy. So it's at the core of the integrated care system. Why the voluntary sector? Why should we become involved in this helping people lead healthier lives? Well, I think all of us in the voluntary sector, we exist, all the charities, all the support groups, we exist because there was a need, because somebody with a lived experience was not getting the support or the help or the advice that they needed. And so they set up a group, and many become leading charities. We have the significant experience and skills and resources. We're very good at advocacy and very good at campaigning. And when we're talking about health, it's easy just to think about the groups that are really connected with with health issues, but we also have to think of the sport, leisure and culture groups as well, because the way that we relax, the things that we do, the sports that we play, going to the theatre, all has an impact on our health and how quick we can recover or how we can cope with things. So Fran, yeah, I turned it round the other way. So Fran had this the other way up. I put neighbourhoods at the top simply because traditionally that's where the voluntary sector is involved, and we are involved in delivering things. And I think that from talking to people in the NHS, particularly the Isle of Wight, we are very much seen as delivery partners and not much else. So that's something that we need to get over. There is an appetite for us to play a role at system level, at government's level. The Integrated Care Board is making very good noises about us being involved in the Integrated Care Partnership. I've been to a couple of assemblies already with Integrated Care Partnership for Hampshire and the Isle of Wight, and there are lots of organisations, voluntary sector organisations from across, mainly across the mainland. I have to say there aren't many from the island, but we will change that. But we need to play more of a role in the place in the Isle of Wight NHS, and that's something that, as I said, that's not going to come overnight. That's a change of culture. And that's something that we're going to have to work on. And that's one of my roles, is to work on that, keep making sure that we are included when it comes to co-designing or co-producing services here on the island. So as Fran says, this is a statutory obligation, and the Integrated Care Partnerships have been directed to make some sort of an agreement with the voluntary sector at system level governance. There are 42 ICSs across England. There are 42 models of working with the voluntary sector, I think. Certainly different ICSs have chosen different models of collaboration. Hampshire and the Isle of Wight have chosen an alliance of voluntary sector organisations across the whole of Hampshire and the Isle of Wight. And they have chosen Action Hampshire, who are also a voluntary community voluntary organisation, to act as convener for this. Action Hampshire are based in Winchester. So last year, for about the last 18 months, Action Hampshire has started to convene this alliance. It's going by the snappy title of Hampshire and the Isle of Wight Voluntary Community Social Sector Health and Care Alliance, also called HIVCA for short. And last year, Action Hampshire had a number of organisations working on tasks and finish groups to identify government structure, secretariat capacity and representation systems. Now, I have to say that the groups that I've been on, there were not many Isle of Wight organisations involved, and I think that's something that we need to change. So registration for HIVCA opened to voluntary sectors in September, and if you want to see more about HIVCA's governance structure and how it came into being, that Action Hampshire have on their website a webinar that they recorded last October that it will explain how HIVCA can work. I'm only going to touch on it here. So we're at the stage at the moment that, like the Integrated Care Partnership, we're waiting for things to be put in place. We're waiting for some funding. We have had a couple of pennies to start it all off, but Action Hampshire are now waiting for some more pennies so that they can start actually recruiting people into leadership roles within the alliance. So HIVCA is open to all voluntary care and social enterprise organisations across Hampshire and the Isle of Wight. And you don't have to have health in your title. It can be any organisations, voluntary or sector organisations. there is the opportunity to stand for leadership and thematic representation positions, and I will explain about those in a minute. It's a chance to share your opinions and to vote on decisions and vote on issues that come across, and participate in alliance events. And the HIVCA itself will feed up into the leadership committee and thematic and place representatives, and that will feed into the integrated care partnerships. This is the structure of HIVCA. There will be a leadership committee with 11 representatives from the voluntary and community organisations across Hampshire and the Isle of Wight. Those 11 will include a chair and a vice chair. It is thought that the leadership committee will spend between 2 and 3 days a month on HIVCA issues, and which they will be compensated for that. Then there are 4 places with 2 representatives from each of the 4 places. So there's 2 representatives from Portsmouth, 2 from Southampton, 2 from Hampshire, and 2 from the Isle of Wight. And those representatives will be 1 from the community voluntary organisation, i.e. here on the Isle of Wight, that would be myself, and 1 other from the voluntary sector. And then there are 10 themes, and the themes will cover children and young people, older people, mental health, carers, neurodiversity and learning difference, physical disability, minoritized communities, gendered health. And then there's 2 spare slots. One, it's thought to be long-term conditions, and they haven't decided what the last one will be. So there's going to be 2 representatives from each of those themes, taken from voluntary sector organisations across the whole of Hampshire and the Isle of Wight. And the 2 representatives will come, 1 will come from a large organisation and 1 will come from a small organisation, to ensure that there is a real diverse community across Hampshire and the Isle of Wight. There's also going to be a selection committee. The selection committee will be made up of voluntary sector representatives who have HR and recruitment experience. So if you're interested in that, please apply when the time comes. The selection committee will be responsible for choosing the leadership committee and choosing the place and thematic representatives. HIVCA will also have a secretariat, and this will be manned with paid staff. They will be managed by Action Hampshire. I'm not sure if they will be remote roles or whether they will be based in Winchester in Action Hampshire's offices. The role of the secretariat will be do all the administrative stuff for the leadership committee and the place and thematic representatives. So how to get involved? I mean, at this stage, the thing to do would be to join the Alliance, go on to Action Hampshire's page, or just type in HIVCA, register your interest. Please only register once, because I registered a few times and they don't like it very much. Sorry, my cat's just come in. Hello. Apply for one of the roles on the leadership committee, thematic place and place representative roles if you can, if you have got time in your schedule to do that. Spread the word. Let's get as many voluntary sector, community and social enterprise organisations on the island onto this alliance, so that we have a voice and advocate for transparent, coordinated VCSE strategic representation with the integrated care boards. Thank you. Okay. Any questions on that? Nope, you're all astounded as I am. Great. Okay, so let's move on, Anastasia, if that's okay. We'll crack on.
Yeah, is it Claire first?
I think so, isn't it?
Oh,
Yeah.
it's Claire. Right. Okay, Claire. Claire doesn't have any slides. So,
no, I'm going to give you a breather from the slides for a minute,
right.
and just talk to you if that's okay. So I'm basically here representing the communications and engagement team for the Isle of Wight NHS Trust, but standing in for Dr. Leslie Stevens, who sends her apologies. And really what I wanted to do was just give you a bit of context and talk about the journey we've been on and set out some of the reasons why this work has come about before Anastasia then talks to you in more detail about Project Fusion. So what is Project Fusion? Well, as the name suggests, it's essentially at the bringing together of all NHS community mental health and learning disability services across Hampshire and the Isle of Wight into a new single NHS trust. As you'll be aware, the Isle of Wight NHS Trust is unique in all sorts of ways. So we have, well, you may or may not know, we have the smallest ambulance service in the country. We have just 16 ambulances. We have the smallest mental health and learning disability service in the country. We also have small community services, and indeed the trust itself is also small by comparison to other areas. Added to that, you'll be very aware, I'm sure, that we have the challenges of being on an island, and for us as service providers, what that means is things like challenges around workforce recruitment. Now, that's obviously not just a problem that we have, that's a national problem, as there are shortages of professionals up and down the country, but we have that additional barrier of that stretch of water, and the cost of commuting can sometimes be prohibitive. So it means literally people needing to relocate here, and we're seeing gaps in our workforce as a result of that. What it also means, though, is professional isolation for many of those staff, because they're quite often just single managers working in an individual service. So they don't have the luxury, perhaps, that other areas have, of other peers that they can talk to in a professional capacity, and that is becoming a bit of an issue. Plus, demand for some of our services is also relatively low for the size we are. Now, that might, might be a surprise to hear me say that at a time when our news and local media is talking about increasing in demand. But, for example, we have to have a mental health crisis service operating 24/7. But the staff that run that service do not see the same level of demand as other areas. Now, thankfully, in many ways, that's obviously the case. But at the same time, they're simply not busy enough to be operating a 24/7 service compared to what you may see in other areas. And of course, all of these things result in financial challenges for the trust. And I think we said some time ago that the trust is not clinically or financially sustainable, and we still hold that view. You'll be aware, I'm sure, that for us, 2016 was a particularly low point when we had an overall inadequate rating by the Care Quality Commission. And in particular, mental health services were rated inadequate, and also community services as requiring improvement. I'm pleased to say that obviously there was a huge amount of work that followed that. And by 2021, the trust was rated good, with community services outstanding for caring. Financially, we're still challenged, but we do have a much better grip and control on our finances. How we got to that point is quite crucial, because obviously we got to the point in part due to our amazing staff, but also a real focus on organisational culture, governance, and also because of our partnerships. And that's one of the things that we want to particularly touch on with you today. So you may be aware that in 2019, our mental health and learning disability services partnered with Solent NHS Trust, and that partnership was then extended to include our community services in 2020. At the same time, in 2020, our acute divisions partnered with Portsmouth Hospital University NHS Trust. And these partnerships have already done much to address the professional isolation issue that I was talking about for our staff, but they've also provided us with really tangible support that has made a difference to both us and to the people using our services. And I'll give you a couple of examples. So back at the start of our partnership, Solent NHS Trust helped by providing an experienced manager for the team who were delivering our No Wrong Door strategy, which is our mental health and learning disability transformation programme on the island. And we're still working together on that today. We also do things like, we will go across there and do quality assurance visits, and they will come here and do the same for us. So we're very much working to support each other in that partnership role. But those, I suppose the thing about those partnerships is they're based on goodwill and generosity. And we have aspirations to really keep improving further and, importantly, to sustain those improvements. So actually, we need our partners with us, not just out of generosity and goodwill, but actually tied into working with us and together being part of one specialist community mental health and learning disability focused organisation. So that's really where this piece of work really started coming into its own. And the opportunity to cement this partnership came following an independent review of those services last year in January. And I know that Anastasia will touch on that review in a bit more detail and go into more of the recommendations that came out. But one of the main recommendations that came out was this proposal to develop this new organisation, a new single trust for community mental health and learning disability services across Hampshire and the Isle of Wight, which is what we are now calling Project Fusion. I think the key thing to stress is that the creation of this organisation will not change what we do locally. We can't deliver mental health and learning disability services anywhere else but here in the community. But what it will do is give us access to training, to supervision, to the career development opportunities our staff need, and that increasing sense of professional working together and reducing that sense of isolation. It will also provide opportunities to make our services more resilient. So, for example, when someone left us recently, we had no older people's mental health psychiatrist in our services, and that left us with a significant gap. Southern Health were able to provide us with a consultant who was working remotely from a base in Southampton. We have now recruited to that post, but that's an example of the kind of support that these partnerships are helping provide. And when you're running really small services like we are on the island, you'll understand that if one person leaves, it creates a significant problem. And actually, it can also get to the point where that service becomes unviable. So we really need those partnerships to help increase our resilience. But I think what we're also very keen to do is to go much further. We want to be much more proactive as a system. Acute hospitals tend to be where the money and the focus goes. And of course, we're seeing a huge demand for their services at the moment. But by doing this, what we also want to be able to do is to form a consistent, clear and single voice for community mental health and learning disability services through this single trust. At the moment, the stage we've got to is we're thinking about what this organisation needs to look like and how it should operate. And that's one of the reasons we're holding these events, because we want you to be very much a part of those discussions. But I think one thing is becoming extremely clear to us as we're working through this is we need to lose our obsession with the boundaries. We need to be much more clever and more flexible so that ultimately it feels seamless from the perspective of those receiving care from our services. So that's, I suppose, just a very quick overview of the sort of context in which we're talking about Project Fusion. Anastasia, will go through in a lot more detail the actual project itself and the priorities and the benefits and so on. I'm happy to take any questions now, or we can do it together at the end of Anastasia's presentation, whatever you prefer.
Any questions for Claire before I start?
So we take them at the end when you finished. Yeah. So
Okay.
you want me to share the screen, actually?
Yeah. So Claire has already mentioned that I'm talking to you about Project Fusion. So I just wanted to give you a little bit of background of where Project Fusion is coming from. And I must stress that whilst we're calling it Project Fusion, that's more a term that we're using our staff to help us identify this thing, but actually we don't have a name for what this new organization is going to be. Those details are yet to be worked out. So in terms of some of the context and the background for this. Oh, can you not hear me clearly, I think?
You are a little bit
It's really
Can you hear me now?
buzzy. It's as if something's vibrating in your speaker.
Oh, is there some? Yeah. Is that any better? Let me just fiddle with it and see if I can change some. Is that any better?
Yes.
Yeah, you can.
Yeah,
all
well done.
hear me now? Okay.
Yeah,
I was just giving some background to where this Project Fusion has started from. So we've been picking community engagement teams and services. I've been picking up lots of feedback from communities about some of the challenges that they're in the sector. Yesterday, I started off by saying, I'm sure you all remember those Thursdays during the pandemic when everybody was standing outside and clapping for the NHS. But those days are gone. We're now down to reality and delivering services. And the challenges have become even more visible. And the pandemic itself highlighted some of the inequalities that we have in the way that we deliver our services. So the ICS and the senior leadership commissioned a piece of work to be done to look at how we can improve the way community and mental health services are delivered across the region. And this report began early last year. I think it was around January last year, and they spoke to key stakeholders and partners, local authorities and NHS organizations as well, basically asking the question about what needs to be done to improve services. And they published a report which made 5 recommendations. You can go on to the next slide, Sandy. So the report that was commissioned identified 5 key areas that required that they felt required improvement, and the report was considered by the board, and it was agreed that they would implement the 5 recommendations. So on this slide, there's 4 recommendations, and these are not in the order that they are in the report, because the top one is about the creation of a new organization. But the recommendations that they put forward, the first one was about needing a review of community and physical health beds. So looking at where they are between community, primary care providers, acutes, and they just felt that they needed to be a piece of work that was going to explore that and address some of the challenges around health beds in the region. The next one is around clinical strategy. I'll say a little bit more on the clinical strategy in one of my later slides. And the third one was around local leadership and having a system-wide strategy for that local leadership. And the fourth one was around funding and having a strategic approach to funding. But they were clear that the proposals for moving towards the new organization were not based on funding or financial justification for doing it. That might be one of the key outcomes that comes out of it, but it wasn't the driver for doing this. Next slide, Sandy. And so they've said the 5th recommendation is the creation of one community and mental health trust. So basically what they're going to do is that from April next year, so from April 2024, this new organization is going to come live. And I say it's going to become live, but there's full recognition that several of the work streams that are going on underneath it will not necessarily be all done, dusted, and complete by the 1st of April. It's expected that in reality, some of these work strands are still going to go on beyond this date, but the organization will become live from this date. And this organization is going to bring together the Isle of Wight. So it's going to pull together the community and mental health elements of the health services on the Isle of Wight. It's going to bring Solent's health services and Southern's health services. And then from the Sussex partnership, it's going to bring in CAMS. So in effect, the smallest part, I think, is coming from the Sussex partnership, which is the CAMS bit that they deliver. And these organizations are going to form the one organization. And I'm sure many of us have been part of change, organizational change, where change is being given lip service. So you might change the logos and they change, the lanyards and so on. But in effect, things continue to be delivered and done the way they've always been done. But the aspiration in this case is that it will be genuine change. And to get this genuine change, they're really keen that we ensure that the voices of the communities and people that use these services is at the center of how this change is delivered. And so we've been going around, we've started going around, and this is just one of many conversations that we're having with different communities and community partners to get input from them as to what the key issues are that are currently in the system. So if you use mental health services, what is it that doesn't feel right for you? What is it that doesn't really work right, that you think, this is an opportunity for this particular issue to be addressed? So this is an opportunity for us to help to shape the changes that are coming. And I must stress that the conversations that we're having are not about whether having one organization, one community mental health trust is a good idea, because that decision is sort of gone. So the conversations are around what and how that community and mental health trust should look like, and what it should do to make it work and ensure that it's effective and meets the needs of the people that need to use the services that it provides. Next slide, Sandy. So I mentioned the clinical strategy earlier on, and Fran had also highlighted a list of priorities. So there's 10 priority work streams that have been identified as part of the clinical strategy. And even though they're 10, it's recognized that there are certain services that we deliver. For just picking one, sexual health services, for example, Solent delivers sexual health services. Just because it's not one of the 10 priorities doesn't mean that it's going to be stopped, or that, or that it's not going to get attention. But these 10 priorities were identified from feedback from that the senior leadership has been getting about the areas that are really challenging and that need to be addressed as we bring together this new organization. So you can see the 10 areas are wide-ranging, from mental health services like CAMS, neurodiversity, old people's mental health, through to some of the physical health areas like primary care, frailty, rehabilitation, and community crisis care, etc. And so each of these work strands has got teams under it that are exploring and looking at how they can ensure that they're getting feedback from communities, and even from the conversations like this that we're having. If you've got specific concerns, for example, around primary care or people's mental health, please do feed that that feedback to us, and then we'll ensure that it's fed back into the system to the relevant teams and groups that are looking at these 10 priority work streams. Next slide, please. And so what is it? What are the main drivers? So I mentioned that funding and finances is not necessarily, it might be one of the outcomes, but it's not the main driver for it. The main drivers for it are to improve consistency of care. We've been, lots of people have been regularly feedback, and you just have to pick up some of the media as well, but to pick up some of the complaints and challenges that people have when they use the systems. Improving accessibility. We've done a big piece of work in Solent where we spoke to we spoke to communities across the region to find out what was important to them in terms of how they wanted and what they wanted from a community and mental health trust. And they identified issues around improving accessibility and addressing health inequalities, ensuring that services are the same to all parts of our community. And then again, with the many conversations that we have, the issue around better joined up services has been an ongoing challenge. And then to improve the experience of people when they use our services. The lists around the benefits that have been identified are much longer than the ones I've identified on this particular slide. And we can make the report is available on the integrated care system, and actually on I think probably all our partner organizations, partners in the 4 trusts that are impacted by this. We've got the full report available on our websites if you wanted to get a full flavor of everything that the full report is saying. Next slide, Sandy. And so I've mentioned that we're in the process of gathering feedback. And the 4 trusts have agreed an approach as to how we're going to do this, because we want to make sure that no community across the patch that's impacted is going to miss out just because one particular community's voice gets the chance of providing more feedback or more approaches in terms of community engagement teams going out to them. So we're wanting to ensure that we're inclusive of the different parts of our community so that we can ensure that everybody's voice is heard as far as possible. And to do this, we need, we need your help. If you are aware of groups that meet regularly, if you're or groups or are able to help us by pulling a group together, to invite us along, put us on the agenda, and we can come and have a conversation and try and gather this feedback to feed into this. So it's an open invitation to all our community partners and our community members to say, look, if you'd like to find out more and if you'd like to ensure that you participate and are able to feed into the development of this organization, invite us along to be part of it, to be part of your conversations. And then I know that you all have been party to consultations that have been labeled as community engagement, where often people come with a list or a whole report of that clearly shows decisions have already been made, and that there's very little conversation you can have to actually change some of those decisions. And for some organizations, engagement is more of a tick box exercise. But in this case, we're truly wanting to use the discovery approach, which is we're not coming with a full set of this is how it's going to happen and this is what it's going to happen, because we really want our communities to be part of those conversations to tell us that actually this is how you should consider making this happen in this bit, because we feel that we use these services and this doesn't feel right, and this is a change that we need. So we're looking to have genuine conversations with our communities, and we're feeding this information back into the system, so that as the work progresses, it can be built in. And actually, at this point, if you ask anybody to give you a full picture of exactly what changes are going to take place in each of the 10 work streams, for example, that I shared in the earlier slides, nobody will have that answer for you. And I think it's right that at this stage of this work, nobody should have the answer for you, especially if we're saying that we want the communities to feed into this, because we should only be having those answers once we've heard back from the communities. And this brings me nicely into the need for us to recognize our community strengths. Sandy had shared earlier on a quote from Cormac Russell that Cormac gave at our event last week. The approach that we want to do, we know that the NHS definitely have some expertise in certain areas, but the communities have expertise as well, and we need to ensure that we're embracing and harnessing the expertise that's within the community and identifying it as well, as we start to shape this new organization, having clear pathways of how we can work with our communities, where communities are able to support the NHS, because we know that the NHS is not able to do everything that's health related. We've got lots of community organizations and volunteer sector organizations that are in that space as well. And then lastly, we want underlining the whole piece is the need for our communities to be part of the creation of the services. So I haven't yet used the word co-production, but in some parts of this work, as it develops, we'll be looking towards doing this using the co-production model. Next slide, Sandy. And so this brings me on to the community engagement questions. Sandy, is it possible to pop these questions into the chat so that we can still have sight of them, and then we can stop sharing?
Yeah, sure. Let me just write these down and I'll type them up.
Yeah. So the questions that we basically want to spend some time looking at is really to get that feedback from yourselves about what do what are the hopes for this new organization that's coming in? What are the hopes and opportunities that you think we should be exploring more of? What are your concerns? So being on the island, and some of the conversations I've had on the island, for example, there's concerns around the fact that will having a much bigger organization mean that the voice of islanders, because we're a small portion of the of this whole puzzle, does that mean that we're going to lose our voice? And the answer that we're assuring everybody is that no, that does not mean that you're going to lose your voice, because your voice will definitely be heard, and it will be part of shaping this, and we'll be including it in. There won't be any voice that's particularly stronger than than the other in terms of weighting and so on. So let's hear your concerns. Let's hear what you think are the good things. Yesterday in the session, a group shared some of the good work that's happening in some areas. And let's pick this up. This is not a negative exercise. I think this should be a positive exercise to identify the strengths that we already have in the system. And if we have strengths, we shouldn't be looking to change them or break them down. Let's look at them and see how we can spread the learning from those strengths that we have. But at the same time, we know that there are things that are just not working well. We know that there's things that just needs to be addressed, and this is an opportunity that we need to take to try and address the things that we know are not working well.
Okay,
so really, let's have a conversation now.
Okay, so if I stop that share, and then we can talk to each other.
Yep. So if anybody's got any thoughts or any questions or any immediate worries about this, or things that you say, actually, I've got this brilliant idea. It hasn't been tried and tested, but I think maybe you should try it and test it. I think we're all, we're open ears, and we're gathering information from wherever we can gather it from. And then we're going to go through a process of feeding it into the system to ensure that it's considered.
Okay, so the questions are now in the chat. If you click on chat at the bottom of your screen, chat should come up on the right hand side. And I will stop recording.
Yep, Annette.